Hello, and welcome to the Dr. Kyra Show, where we use science to change ourselves, others, and the world. Today I want to talk about why we need to have emotions designed into healthcare technology. Healthcare technology is booming. It's everywhere. Every time I go to get something else done in healthcare, there's some sort of digitized system or gadget or new portal that I have to join, even to get my records. One of these stories that I heard made me cringe. There was this couple, this elderly couple, and the husband was, fighting cancer, and it was a very nasty, horrible cancer. It took many months of the couple fighting and going multiple times to the hospital, multiple clinics. The wife was doing all the caregiving for her husband, and she joined under his name to his patient portal so that she could look at all the medical records and the doctor's notes and communicate back and forth with the doctors, nurses, and social workers, etc. She found it really helpful. So that's a win, right, for the healthcare technology. But then, unfortunately, her husband lost his battle with cancer. And after a really lovely funeral, she really wanted to express her gratitude to the care team, to all the clinicians and all of the social workers who had helped her husband and her. So she writes this really sweet note inside of the patient portal and waits for a response. To her horror, she finds that a system reply comes to her that says, "This patient is deceased. Messages cannot go through." Just take that in for a second. As we think about all the ways in which technology can help us to have better health, to have more permanent records, to carry our records from doctor to doctor, we also have to be super careful that we as patients are speaking up about the need to be emotionally intelligent with the way that we use technology, that it doesn't break our common decency and our common human societal rules and just good manners to use these tools and to make it more convenient for us, that the tools serve us, and at the same time somebody has been thoughtful enough to go back through and make sure that what they've designed, it has no chance of being offensive or insensitive or even hurtful. So some of you and many of you are actually in charge of designing these things. And even if you're not, you are the patient or the caregiver of somebody who is increasingly coming into contact with these tools. So may we all speak up and demand a really, really sensitive, emotionally intelligent system that makes us feel human. For more tips and thoughts on these things, please join the Dr. Kyra Show. You can subscribe down below and send me your comments. I would love to read them and respond to them. I'll see you next time.